So in today's topic, we will be discussing about B complex vitamins. Okay, from the exam point of view, which all aspects are important, the sources, the deficiencies, what it will lead to, and specifically, you have to focus more on the functions of these B complex vitamins. Okay, in detail, you have to focus on the functions. These are the elements which are very important from this particular course. Okay, if at all anyone is joining late, please help them out with the page numbers or with the topic name. Okay, this is vitamin B complex. There are three chapters we will cover up in this class, all covering up all the major important aspects. Okay, and there is an aspect of nutritional anemia because of folic acid deficiency anemia that we will discuss in another chapter. Okay, that is the only area which is quite in depth in these chapters, but that itself is another full session, full one length session of 2 hours. So for nutritional anemia, we will be discussing it in a separate class. Okay. Except that, all the other areas, the functions, specifically, you have to focus a lot on the functions of these B complex vitamins. Okay. Am I audible to all? Is my voice clear? Am I audible? So page number is 344 in old textbook. You can mention the new textbook's page number in the chat box. Those who have the new edition textbook or the students who have joined recently, they have received the textbook recently. You can add the new page numbers in the chat box. Okay, 344 is also the same page number in the new book. So with that, we will start today's session. So B complex 1, that is vitamin B1, thiamine. Okay. At the end of this chapter, I'll give you a small assignment related to this chapter, which you will be finding it easier to study when it comes to the your examination time. Okay. So keeping your examination in mind, we'll give a small assignment at the end of this session. Not compulsory, but if you do that assignment, it will be well and better for you. If you can save that notes, it will be very well and better for you. Okay, for your future reference as well as for your exam practice. Okay, so vitamin B12, B1, thiamine, and it is also a B complex which is known to prevent the deficiency called beriberi. Okay, vitamin B deficiencies, most common one is beriberi. So thiamine deficiency leads to beriberi. That is one of the first reason of beriberi. Okay, so functions of this B complex thiamine. You will notice that the functions that we will discuss one after the other for all the upcoming vitamin B complexes, you will see some similarity. Okay, some similarity in the functions, how they act, in which part of the body system they are important for the general well-being and health. You will see the similarities there. And also when it comes to deficiency, okay, even in deficiency you will see certain similarities. Okay, how different B complexes, when they go deficient, they show up with the same signs and symptoms. Okay, so functions, it is essential for the release of energy from carbohydrates. That is the metabolism of carbohydrates. For the metabolism of carbohydrates, thiamine is important. It is necessary for the appetite and good health of the general humans, and it is needed for the normal functioning of the nervous system, central nervous system. You must just by the first function here, it is essential for the release of energy of carbohydrates. When we take cereals and pulses, okay, the outer cover of the cereals and pulses, they are rich in thiamine. Okay, so nature in its way has given us carbohydrates and also the medium which can metabolize carbohydrates in its natural form. All the cereals and all the pulses, okay, which are loaded with carbohydrates, they are formed in nature in such a way that vitamin B1, thiamine, is generally found in the outer husk layer of the carbohydrates. So when it comes to polished rice, okay, you have parboiled rice, brown rice, and polished rice. Okay, which do you think has the highest quantity of thiamine? Polished rice, parboiled rice, brown rice. Based on this particular fact, which do you think has the highest quantity of thiamine? It is brown rice. In polished rice, remember, you are taking away the outer covering. Okay, so a majority of vitamin B complex thiamine is as it is lost in the process of polishing the rice when you get that polished white rice. Okay, on top of that, when you are cooking the polished rice in such a way that you're straining away the water, okay, when you're straining away the water, you are losing majority of the B complexes. So can you just name certain examples of the states in India where polished white rice is the staple food? Not rice. I'm specific about this. Polished white rice is the staple food. Certain states in India. Yeah, in Andhra Pradesh, they do use white rice. That's a staple. Assam, Meghalaya, West Bengal, Bihar, Chhattisgarh, Jharkhand. Okay, so these are the, in Kerala, most of South India, it's not white rice. In Kerala and Tamil Nadu, they use parboiled rice and brown rice more. Okay, that is the staple. White rice is not used. White rice is usually used by the Brahmin communities, okay, or the upper class Brahmin communities are the ones who use who exclusively use white rice only in certain parts of Kerala and Tamil Nadu. Otherwise, parboiled rice and brown rice is the most common rice used. But other states which we have mentioned here, parboiled rice, it does not have that brown color to it. Okay, it does not have that red brown lines to it. Okay, you have to boil the rice. You have to strain away the water. That is a parboiled rice. Okay, in white rice, you do not have to strain away the water. And straining away the water and cooking the white rice, that is the wrong way. Do not cook the white rice like that. You are losing all of the whatever remaining B complex is there. You are losing it. Okay, so do not strain the water and cook white rice. Parboiled rice and brown rice, you do not have any other way. You have to cook it in that particular way. Okay, but white rice, do not strain away the water. Okay, take adequate water, exactly what will be completely used up for cooking the rice. That's the correct way of cooking the white rice. Otherwise, you will lose your whatever vitamin B complexes are there, that will also be used. And that is the reason why. This is the reason why. Yeah, it can be washed before, but do not overwash it. White rice, do not overwash it. When you wash the rice also, you are losing vitamin B complexes. Do not overwash it. Okay. There are certain communities who believe that you have to wash the rice as much until and unless you get that clear water. That's a wrong way. Okay, washing the rice once or twice is more than enough. Don't go to 3 times, 4 times and all. Okay, you will lose the vitamin B complexes. Okay, so this is the reason why having white rice will have a sudden spike in your blood glucose level as you compare to having the same amount of parboiled rice or brown rice. Okay, that is the reason why brown rice and parboiled rice is preferred more, considered healthier than polished rice. Okay, reason being, it has majority of the vitamin B complexes, which itself will help in the metabolism. Okay, easy metabolism of and well metabolism of this carbohydrates present in the rice. Okay, so deficiency of thiamine will cause fatigue, depression, irritability. These are just signs and symptoms which is very common with other disease conditions as well. The only way you can identify deficiency is along with all this fatigue, depression, irritability, there are certain skin symptoms as well. We will discuss that when the vitamin B complexes will come up. We will discuss that in detail. But apart from that, blood test, okay, to be sure, to diagnose something for sure, blood test is required. Okay, with blood test also you can identify what kind of deficiency, microvitamin or any major deficiency a person is going through. Okay, and in deficiency, severe deficiencies will lead to beriberi. Beriberi is a disease of the nervous system. As we know here, it is required for the normal functioning of nervous system. In deficiency, something wrong will happen to the nervous system. Common in countries where polished rice is the staple food. Okay, So thiamine deficiency diseases, first is beriberi. There are different types of beriberi. Where polished rice is the main diet. Okay, that beriberi happens more frequently. Okay, signs of there are infantile beriberi, adult beriberi, and apart from that, there is wet beriberi, dry beriberi. Okay, we will see that as well. So in infantile beriberi, it happens in small kids. Okay, when the mother herself is deficient in vitamin D complex. If those who are from the previous classes, or the students who are still attending the classes, they would know vitamin D complex is a nutrient that is transferred from the mother's present nutrition, and it will go on to the lactating mother's present nutrition, and it will go on to the child who is being breastfed. Okay, so if the mother is undernourished, if the mother is deficient, her breast milk is also deficient in vitamin B complex, and because of the reason why the infant who is being breastfed will also suffer from beriberi, that is infantile beriberi. So the child will have tachycardia, that is increased heart rate, vomiting, convulsions, and a shrill kind of cry that falls down slowly. The pitch of the cry is quite high, and then there is no sound at all. Okay, these are the other symptoms that comes in the later stages. Okay, adult beriberi, dry skin, irritability, progressive paralysis, because remember, central nervous system is involved. So peripheral nervous system is the one which will start getting worse and worse, and only then the central nervous system will get the final symptoms. Okay, so from the peripheral nervous system, peripheral neuritis, okay, numbness and tingling sensation in the fingertips, these will start, and then it will progress further and further it will progress into a worse condition. Okay, Wernicke-Korsakoff syndrome. This is seen in alcoholics. Okay, alcoholics, those who are alcoholics, they also develop beriberi because of the inflammation of too much of alcoholism and the impact it has on the liver's health as well. There is a decreased absorption of vitamin B1 from the intestine. Okay, so Wernicke-Korsakoff syndrome is specifically seen in alcoholics, and this is the reason why in de-addiction centers or rehabilitation centers, when alcoholics are admitted, immediately they are put on vitamin D complex supplements as well. Okay, apathy, loss of memory, rhythmic to and fro movements of the eyeballs. They will look at one place, take away their eyes, and again go back and look at that particular place. Okay, and it is like it is very fast. Okay, to and fro movements. It is a kind of along with withdrawal syndrome, it can get you may misjudge it for withdrawal syndrome as well. Okay, because alcoholics, when they are undergoing de-addiction or rehabilitation, they will undergo withdrawal syndrome, so it may get misjudged with withdrawal syndromes as well. So apathy, no, very rude. Okay, not at all considerate about others' feelings or others' well-being. Okay, loss of memory and rhythmic to and fro movements of the eyebrows. These are the signs and symptoms of Wernicke-Korsakoff syndrome. So next we have wet beriberi and dry beriberi, common in adult. Okay, in wet beriberi, a complete body edema will be noticed. Okay, the cardiac output or high cardiac output, heart failure, because the entire body is edematous. There's a lot of fluid volume accumulated in the body. Okay, in the blood, in the circulation, as well as in the interstitial spaces as well. Heart hypertrophy, because from a very long time, the cardiac output was high, and because of which the heart has increased in size to pump this huge amount of blood into the system. Automatically the heart will go certain anatomical changes, and that leads to hypertrophy. It's increased size in the size of the heart, specifically the right ventricle. Tachycardia, increased heartbeat, or bradycardia, when in some cases it may go into tachycardia, other times it may go into bradycardia, low heartbeat. Dyspnea, not able to breathe properly, because edema may be around the lungs as well. Okay, swelling may be around the lungs as well. Emphysema may be present, empyema may be present, and edema in the lower extremities. Oliguria, very less amount of urine, they urinate quite less. and lactic acidosis. The lactic acid accumulated in their muscles and in the soft tissues. Okay, so this is the signs and symptoms of wet beriberi. And we have dry beriberi, peripheral neuropathy, which I have mentioned. It starts with tingling and numbness in the fingertips or at the toe tips. Okay, and slowly it progresses upwards. Muscle weakness, gait ataxia, that is imbalance, and paresthesia. Paresthesia again, you lose your sensation. There is a numbness, overall numbing feeling is there. Okay, numb feeling is there. That is paresthesia. And Wernicke's encephalopathy, that is a central nervous encephalopathy, is a central nervous disorder. So these are the signs and symptoms which you see in wet and dry beriberi. Infantile beriberi occurs in infants who, by the age of 3 to 4 weeks, such young kids who are breastfed by thiamine deficient mother. If the mother is thiamine deficient, obviously the breast milk will not have adequate vitamin B complex. But when the mother automatically increases her vitamin B complex intake while she is lactating, automatically the quality of the breast milk will also change. Okay, heart failure in infants, which may occur suddenly. Aphonia, this is like they do not have that sound in their cry. Okay, they appear like they're crying. They are crying, but there is no sound to it. Okay, the absence of deep tension reflexes. When a child is born, there is a certain set of reflexes which happens only to a newborn baby or an infant. And slowly, when they progress in age, all these reflexes will pass. Okay, it will move away. Okay, but there are certain tendon reflexes, the way how the child's leg should move when it is struck slightly, or how the hands should reflex. Okay, how the hands should grab or grasp when something is put on the palm. Okay, there are different reflexes like that, and these reflexes are absent in a child who is thiamine deficient. Okay. Next, the sources of vitamin B1, thiamine. This is where somebody had mentioned about being B1 deficient. These are the areas which you can, these are the food you can add more into your diet to overcome that. Or if based on your deficiency, if it is mild to moderate, just by doing certain lifestyle changes and dietary changes, you can overcome the deficiency. But if it is moderate to severe, in that case, you have to depend on supplements. Okay, and this guidance will be given only for this guidelines. All these guidelines will be given only by the doctor who is checking your blood group or blood results. Okay, cereals, pulses, oil, seeds, nuts. Okay, and milk, it is something that vegetarians can have. Meat, fish, and egg, that is for non-vegetarian. Okay, you definitely have a lot of vegetarian sources which has vitamin B1. Okay, that is thiamine. In the textbook, you can check that as well. They have given the best sources of thiamine, and specific seeds also they have mentioned, like sunflower seeds, pistachio, mustard seeds, groundnuts, cashew nuts, garden press seeds, peas, fresh peas, the green peas that is fresh, not the one that is sun dried. Okay, agati leaves, soybean, that is brown soybean, red gram, dry peas as well, moth green, whole lentils that are whole brown. Okay, dal or lentil, not the polished one, which is whole. Okay, the whole brown lentils. And green gram, that is moong dal, that is whole, and not the one that is cut. Okay, the whole moong dal. Wheat, that is whole wheat. Okay, these are the best sources of thiamine. Okay, so majority of this is vegetarian only, but definitely non-vegetarian sources also have vitamin B1. Coming to certain functions which is given in the textbook regarding vitamin B1, energy transformation, which we have discussed, converting carbohydrates into energy. Okay, for that thiamine is required, and the synthesis of NADPH, that is important for the RNA and DNA synthesis. Okay, the sugars that are present in your RNA and DNA, for the synthesis of that, thiamine is required. Nerve conduction, because of the nerve health. Okay, thiamine is involved in the transmission of high frequency impulses across the entire nerve system. Okay, and conversion of amino acids, certain proteins, okay, amino acids, proteins enter your body, they are metabolized into amino acids. These amino acids are the building blocks for another protein in your body. So conversion of these amino acids into a different source of different kind of protein which can be used in your body, for that also thiamine is required. Okay, and other signs and symptoms of beriberi, which we have not shown in the slide: loss of appetite, anorexia, decreased muscle tone, okay, mental depression, confusion, and certain neurological changes, like your balance, okay, you're walking and suddenly your balance may fall off. Okay, these are noticeable, and it is very slow. The thiamine deficiency symptoms will not happen suddenly. Okay, it takes months and months of deficiency of thiamine for all these symptoms to show up. Okay. So is it clear about thiamine so far? Thiamine, the important aspects of thiamine. Is it clear so far? Next is vitamin B12, riboflavin. So the treatment of thiamine deficiency and beriberi, it is clinical management. Okay, at what mg, what doses? Okay, these are given by the clinical practice, clinical guidelines. So the treatment of beriberi and all is not done by the nutritionist or dietitian. It is done by a specialist, a physician in a clinical setting. Okay, it's usually 5 to 10 mg of thiamine doses is given for a very long period of time. So to whoever is affected with beriberi, okay. In infantile beriberi, 2 to 5 mg of thiamine is given. Okay. Next, coming to riboflavin, that is vitamin B2. So it was an enzyme. It is a yellow colored enzyme. It has a distinctive color. Okay, it's a yellow colored enzyme which was recognized in the year 1970. Okay, it is recognized as a vitamin. Okay, it had certain vitamins have a certain criteria. Okay, only to which they can be identified as vitamin. Okay, so 1917 we came to know about this vitamin B2 called as riboflavin. So functions of riboflavin, again, metabolism of carbohydrates, proteins, and fats. Thiamine was only used for the metabolism of carbohydrates, but here riboflavin is important for the metabolism of carbohydrates, proteins, and fats as well. Growth and repair and development of body tissues, healthy skin, eyes, and tongue. And it has a principal growth promoting factor in this vitamin B complex for the growth. But riboflavin is very important for the growing children as well, for their growth and development. Okay. And the release of energy from carbohydrates in the form of glucose, proteins in the form of amino acids, fats in the form of lipids. Okay, thiamine is required, and also to convert certain amino acids like tryptophan into any other form of active vitamins like niacin. Riboflavin is required. Riboflavin usually acts as a catalyst. Okay, in short, riboflavin acts as a catalyst in various other biochemical changes in your body. Conversion of vitamin B6 and folate into their active coenzyme. Okay, and only then if it is converted into a coenzyme form, only then the body can store it. Your body cannot store folate as it is or vitamin B6 as it is. It has to be converted into some other specific form. Only then your liver can store it for a long period of 6 months and so. Okay, so to convert certain vitamins into its storage form, okay, riboflavin is required. So deficiency, again, loss of appetite, swollen tongue, cracked lips, eye infection, dermatitis. Okay, and when you eat something that is rich in riboflavin, immediately in your GI tract, upper GI tract, that is your stomach, okay, your duodenum. In that GI tract itself, riboflavin can be absorbed. And when you are having meals, okay, 70% of riboflavin is absorbed along with meals, and only 15% of it can be absorbed when it is taken alone in the form of supplement. Okay, so riboflavin will get absorbed sooner when you are having a meal that is filled with other vitamins and nutrients as well. So usually when riboflavin supplements, if it is prescribed, okay, by a physician, if it is prescribed, usually they will give they will guide you to have riboflavin just before or just after having meals. Riboflavin supplement soon, just before or after having meals, because it is absorbed readily. 70% absorption is sure with the presence of other nutrients. So deficiency, it is very common among low income groups, low socioeconomic groups, and those population parts of any region of the world, not just in India. And any population who has a very cereal based kind of diet, and they do not use much of pulses and milk or any other protein sources. Usually we see this behavior pattern in people who are from a very low socioeconomic background. Okay. And the deficiency is also associated with tuberculosis, prolonged fevers, any malabsorption syndrome, hyperthyroidism, any cancers, malignancies. Okay, it means that people who are suffering from these disease conditions like tuberculosis, prolonged fevers, malabsorption, hyperthyroidism, and cancers. Okay, there's a common factor that is seen, that they are specifically riboflavin deficient. Okay, so that may be some association between with being riboflavin deficient and getting these disease conditions. These are communicable as well as non-communicable disease conditions. So you can see here certain symptoms which is characteristically seen in riboflavin deficiency. Glossitis, that is the inflammation of the tongue. Chiliosis, you can see the entire lips is inflamed, cracked. Okay. Itching and burning eyes. It is not allergic. Okay, it's not itching and burning eyes is also a symptom which is seen in people who are allergic to dust or any other source, pollen or any other source. But this is a completely different case of itching and burning apart from being allergic to anything. Stomatitis, glossitis, stomatitis, angular stomatitis, that is the corners of the lips will undergo inflammation and they will crack. It may bleed as well. Then the best sources of riboflavin, it is yeast. Yeast is used in bread making. If you don't consider yeast as a non-vegan option, then you may avoid taking yeast as well. But otherwise, any food that is made with yeast automatically becomes riboflavin rich. Whole grains, any whole grains, dry beans and pea, fresh and dry pea as well. And green vegetables. RDA, whatever is given in your textbook, you can follow that. The RDA which you see here may slightly vary from what is given in the textbook, because this is a completely different source which I'm showing on the slide. So apart from the skin lesions and dermal lesions which we have seen here, apart from that, certain neurological manifestations are also present with riboflavin deficiency. Okay, like people or children in develop, because riboflavin is very important in growth and development. So in kids who are riboflavin deficient, the reaction time, you ask them question, they may know the answer. Okay, but the way how they will get the answer, that spark of answer in their brain is delayed. Okay, the reaction time is delayed. Hand grip and strength. Okay, they are very clumsy. You think you may call them clumsy, or you may call them they're suffering from ADHD, but it may be different. The grip, the strength of the grip of their hand is very low. Okay, so it leads to clumsiness, and the motor coordination is also at a disadvantage. Okay, for example, there are certain exercises which you can do to, for example, if you continuously say a child to cross their hand and try to pick their put their right index finger on the tip of the right nostril, or left index finger to the tip of the left nostril, these kind of in a quick way, not in a slow way, okay, in a quick way. So this showcases that how the growing or developing child's motor coordination is, what they hear, what they listen, okay, and how they try to imitate whatever you are asking them to do. Okay, so that is a way how you can check a motor coordination. You can search this in YouTube as well. Okay, how to assess the motor coordination. You will get various tricks and various activities with which, not just for children, even for adults, you can check their motor coordination. Okay, so people who are at the disadvantage, okay, their motor coordination is not that well, could be riboflavin deficient. And normocytic anemia, the type of anemia associated with riboflavin deficiency is normocytic anemia. Normocytic anemia, can anyone understand what is the meaning of normocytic? Normocytic. People who are from the medical background, you can guess. What is the meaning of terminology? It's a medical terminology, normocytic. The RBCs are of normal size. When we are speaking about anemia, okay, we are speaking about the RBCs in general. Okay, normocytic means the size of the RBC is normal, but still it is anemic. Okay. When we will discuss about nutritional anemia in detail, we will discuss about various different types of anemias as well in that particular chapter. So is it clear about riboflavin? And again, riboflavin treatment, 5 to 10 mg of riboflavin treatment is adequate on a daily basis. Oral supplement or dermal injections can be also given. And kids who are preterm, before the due date, when the children are born, weeks before, when kids are born, weeks before the due date, okay, they come under the preterm category. So in preterm children, riboflavin supplementation has to be given. That's a clinical part, not just for nutritionists and dietitians. Clinical part, it is taken care by the pediatrician. Yes, you do lose these vitamins when you cook, because can anyone guess what would be the reason here? We're talking about B complex vitamins. Why do we lose vitamin B complex vitamins when we cook them? It is water soluble. It is water soluble. This is the reason why when you wash them, they go away. Okay, when you cook the rice and you strain them, the B complex will be leaving the food. Okay, because they are water soluble in nature. Any vitamin that is water soluble in nature, as the cooking process increases with temperature and time, you increase the temperature over a period of time, and you take longer and longer time to cook the rice or cook any food item that is rich in vitamin B complexes. With that steady increase, you are losing a lot of vitamin B complexes. Okay. So the food stuff, apart from the ones which is given here, the other foodstuffs which are given in the textbook, drumstick leaves, okay, really good source of riboflavin. And not just riboflavin, all the vitamin B complexes are really potent in drumstick leaves, fenugreek leaves, okay, crown nut, okay, in all these sources, all the different forms of all the different forms of vitamin B complexes are quite rich. Okay, bajra, quinoa, green gram, soybean, white soybean, okay, amaranth leaves, drumstick leaves, mint, pudina, okay, mustard leaves, cow's milk, egg, if you are a non-vegetarian, egg and the whole raw egg. Okay, it is a really good sources of riboflavin. Yeah, any machine processed foods also. Like for example, the meat, that sausages. If you're a non-vegetarian, when you eat meat in the form of sausages, you eat processed meat. Okay, these are deficient in vitamin B complexes. Okay. So is it clear about riboflavin so far? Next is niacin. It's vitamin B3, niacin. So again, in 1930, in the year 1937, niacin was discovered. It was given the title of a vitamin B complex. Okay, and niacin is a very generic term. It is used to all the derivatives of nicotinamide comes under this umbrella term of niacin. Okay, and something that is niacinamide. Okay, it is also another component and or another derivatives of nicotinamide, which is very prevalent in skincare these days. Okay, niacinamide. If you have come across niacinamide moisturizer, niacinamide serums, okay, and the importance of it preventing skin drying, okay, and preventing blemishes on the skin. Okay, you must have come across this particular name, right? So yeah, it is a form of vitamin B3. Okay, it comes under the niacin is the umbrella term used for all the nicotinamide derivatives. Okay. So the main functions of niacin helps our body to convert nutrients into energy, okay, specifically carbohydrates and also protein and some kind of fats as well. It helps your body to make fat and cholesterol. Fats and cholesterol are important for your good health, okay, but it has an upper limit. When the upper limit is crossed, that's when you get lifestyle diseases or problematic heart health. But otherwise, cholesterol and fat is required by your body because hormones, okay, to prepare hormones, this cholesterol is important, fats are important. Okay, cholesterol is a catalyst and is also the product used to make many other hormones in your body. So if you go low and very low in fat and cholesterol, your the hormonal imbalances will start. Okay, so to make fats and cholesterol within your body, niacin is required. It also helps to repair your genetic material. Any small mutations that is happening here and there, the presence of niacin will take care of it before it progresses and forms into something carcinogenic or it leads to some benign tumor or malignant tumor. Okay, the presence of niacin can take care of the small cuts and bits in your genetic material. And absorption, it is absorbed in your stomach and small intestine. Majority of the niacin is very readily, easily absorbed in your stomach as well as in your intestine. Whatever is remaining in the chyme, that will go into the intestine and it will be absorbed. And once it is absorbed, it is formed into, it is converted into coenzyme. Okay, so to convert that into coenzyme, which vitamin B complex is required? To store niacin in your liver, in your kidneys and brain, okay, it has to be converted into a coenzyme in different forms of coenzyme, NAD, NADP coenzymes, okay. Which vitamin B complex is required for this conversion to take place? Just now we had discussed. Anyone? To convert niacin into a coenzyme. Only when it is converted into a coenzyme, your body can store it. It is riboflavin. Okay, vitamin B2 is required to convert vitamin B3 into a coenzyme so that it can be stored in your body. Okay, at least approximately for 6 months, maximum for 6 months, these soft tissues, your liver, kidneys, and brain can store niacin. Okay, the coenzymes of niacin. Okay. They have given the niacin and tryptophan interrelationship in your textbook, which is not that important for you. That's a biochemistry part. It is too much into the medical part. Okay, that is not that important for the diploma level course. Okay. So deficiency, these are the symptoms which you can see. It leads to pellagra. Over a period of time, when the niacin deficiency is not it is not addressed, if it is left unaddressed, it leads to pellagra. We will see pellagra later, but before that, certain symptoms that takes place at the central nervous system level: fatigue, depression, memory disorders, dementia. At the GI system, loss of appetite, nausea, vomiting. Skeletal system, performance. So for athletes and sports personalities, they have to make sure their vitamin B complexes are not in the deficient side. Diarrhea in pellagra. Dermatitis, that is also another symptom of pellagra. So this is how pellagra looks like. A disease due to the vitamin B3 deficiency. It is associated with more than one symptoms, which may include, first is dermatitis. You can see here the redness, and it is itchy. It will be itching as well. Okay, it's an inflammation of the skin. Dermatitis, inflammation of the skin. So the redness that you see here over the hands, okay, and the swelling, the redness which you will see here, that is dermatitis. Okay, diarrhea, that is that we saw the pellegral diarrhea that happens in the GI system. Dementia, that happens in the central nervous system. So three major systems of your body, three major organs of your body is involved. So it could be these three symptoms and plus more. Okay, plus more, that is pellagra. Okay. Dermatitis, diarrhea, and dementia. Okay, so these three are there, and these three could be there, plus more symptoms can also be there in pellagra. It is very subjective. Okay. And diarrhea is not found in mild deficiencies of pellagra, only when it leads to it progresses and it worsens, the condition worsens. That's when diarrhea also comes into play. And nowadays they have found out that dementia is always not the end result of pellagra. In certain individuals, it may just lead up to depression. Okay, dementia is not always the end result of pellagra. In certain individuals, it is replaced by depression. Okay, but still it is something that starts with D. Okay, so for pellagra, you have to remember these three Ds: dermatitis, diarrhea, dementia, or depression. Okay. And these rashes which you see, it is usually seen on the extremities, either upper extremity or lower extremity, hands or feet. Okay, on the extremities only these kind of lesions are seen, pellegral lesions are seen. Next we have is this Cassell's necklace. And usually this is seen in the inmates, okay, people who are in jail, and they have a very bad kind of diet, and even the healthcare scenario for inmates, okay, it's very substandard. You take any country for that matter, the health, the physical health, the mental health, and emotional health of the inmates, or the criminals who are imprisoned, okay, it's very substandard everywhere. So the diet is also substandard, and because of which Cassell's necklace is a kind of vitamin B3 deficiency, which is usually seen in inmates. Okay, you can see this distinctive the color change at the collar region of the neck. Okay, this is called Cassell's necklace. Okay. Then we have another situation called as the drug-induced pellagra. So here the diet is completely balanced. The patient, whatever diet they're having, is completely balanced. But because of being on these drugs, anti-tuberculosis drugs, anti-epileptic drugs, that is for convulsions or fits or seizures, whatever drugs is given, chemotherapy and other immunosuppressive drugs. Immunosuppressive drugs are given for transplantation patients soon after transplantation and before transplantation. Immunosuppressive drugs are given to these patients so that their own body will not attack the new organ or new tissue. Okay, so their immunity is suppressed for it is purposefully suppressed for a pretty small period of time. Okay, so these drugs have they can cause pellagra because they can decrease the absorption of niacin in the intestine. Okay, you don't have to by heart the names here. Just remember anti-tuberculosis drugs, drugs used in TB, drugs used to treat epilepsy, seizures or convulsions. In chemotherapy, cancer treatment, and immunosuppressive drugs can lead to drug-induced pellagra. So it can be cured, pellagra can be cured with a good diet, which has adequate amount of protein, tryptophan, or niacin as well. Okay. And other members of B complex vitamins are also required to cure the pellagra. The diet management has to be done here. Along with that, doses can be given, supplementation can be given, 100 to 300 mg of niacin supplement on a daily basis. Orally, it can be given to correct the pellagra. And certain prevention methods is sorghum. Sorghum is jowar. Okay, you can replace jowar with other cereals. Can you name the states in which jowar is the staple diet? Jowar or sorghum? Another name for jowar is sorghum. States where jowar is a staple diet. Yeah, North Karnataka, Maharashtra. In Maharashtra has the highest amount of jowar consumption. Karnataka, they still go for ragi. Ragi is the first option, right? Maharashtra, jowar is a staple diet apart from rice. So replace the jowar with other cereals, other millets or cereals that can also prevent pellagra. And if you cannot replace jowar, you have to consume good quality protein. Good quality protein, it means you have to add more milk, eggs, meat into your diet. And if you are vegetarian, you have to go for the substitutes of good quality protein from the vegetarian list. And you can fortify bread with niacin. That is done in the at the government level, because these policies the government has to approve. Which packaged food can be fortified by what kind of nutrient. Okay, these policies the government has to review. And already in India, bread, milk, they come fortified. Even the plant-based milk, which you can buy, if you check the packaging, they come with vitamin A, vitamin D, vitamin B12 fortification. If you look closely, okay. And you can distribute yeast and niacin tablets as a part of public health program. Public health programs, it will be free of cost. Okay, distribution of niacin tablets and yeast tablets. Okay, it can be free of cost as a part of public health program. And including groundnuts on a daily basis. Okay, peanuts or groundnuts on a daily basis. A handful of groundnut on a daily basis can cure your majority of the B complex, except vitamin B12. Vitamin B12 you will get only from non-vegetarian sources. Apart from vitamin B12, all the other B complexes you can find a cure in just having a handful of groundnut or any other seeds. Okay, having multigrain, whole grain cereals and pulses. Okay, these can solve majority of your B complex issues. Apart from that, the best sources of niacin is broccoli, peanuts, chicken, mushrooms, button mushrooms, bell peppers, capsicum, kidney beans. 10 mg of niacin per day has to enter your body depending on the RDA. Indian diets usually provides 10 mg. And estimated requirement of niacin on a daily basis is around 5.6 mg. But if you have a balanced Indian diet, it can easily give you 10 mg, double the RDA. Okay. So apart from that, good content of niacin food is also given on page number 367. They have mentioned about groundnuts as well. It's a very good source of niacin as well as thiamine. Okay. And also their groundnuts are a good source of protein as well. Protein and good fat, calories. Sheep liver, groundnut, chicken, poultry breast, that is skinless chicken. Okay. Chicken breast, tuna, fish, gingerly seeds, that is the sesame seeds, white in color, and almond, oyster mushroom, rice, which is white rice, raw and brown, barley, maize, and maize, that is corn. Okay. Whole wheat, lentil, that is whole brown lentils. Whole brown lentils are not commonly used, only in rural areas. I guess it is used. In urban areas, people usually go for the yellow lentils. Okay, the tuar dal, that is yellow in color. But if you go to rural areas, they usually use the brown ones, which is the unpolished one, and it is much more cost effective as well. And even I guess, if correct me if I'm wrong, if in the ration shops as well, do they provide the brown lentils or do they provide the same tuar dal? Because I'm not sure about it, but I guess in ration shops, the kind of lentils that you get is the brown one, not the polished yellow one. We can put, if anyone knows about this information, you can just put it in the chat box. Okay. Parboiled rice is a good source of niacin. So till niacin, is it clear to everyone? So far, is it clear? Next is folic acid, B9. Okay. The nutritional deficiency of folic acid is very well known, associated with anemia. So apart from that, what are the other functions of folic acid? It helps your cells to grow and multiply. Growth and development, folic acid is required. Helps to form your RBCs. For RBC formation, iron, folic acid, copper is also required. Okay. Apart from folic acid, these are the other elements which is required for the formation of RBCs in your bone marrow. Helps to form the genetic material, sugars of your RNA and DNA. Keeps the healthy function of your brain and nervous system. Supports the brain development during pregnancy, the brain development of the child as well, and not just the brain development, the neural tube closure. Okay. Neural tube closure of the growing fetus. Okay. Folic acid is required. So the mothers who do not have enough amount of folic acid in their diet during pregnancy, we have seen that these mothers give birth to children who suffer from either spina bifida or cleft lip, cleft palate, encephalopathy, okay, anencephalopathy. So these kind of births that take place, if you check the mother's blood report, there is it is seen that mother is folic acid deficient. This is the reason why in pregnancy it is compulsory to have folic acid tablets along with iron tablets, iron supplements. Okay. Balances the level of homocysteine in blood. Homocysteine is a protein which is present in the blood. It leads to the lysis. It leads to the breakdown of RBCs to control the levels of homocysteine in blood. Folic acid is required. Otherwise, if the homocysteine goes beyond the normal rate, it may lead to too much of breakdown of RBCs, which can further aggravate the anemia. Okay. So these are the major functions of folic acids. Deficiency, sensations of weakness, numbness, tingling of the fingers and toes. As I mentioned earlier, this numbness, paresthesia is commonly associated with most of the vitamin B complexes, because majority, if you have seen, majority of the vitamin B complexes which we have discussed have certain association with the health of the central nervous system. Okay. Ulcers in mouth, sore tongue, feelings of weakness or fatigue. Okay. Fainting. Fainting is also associated with anemia. If you're anemic, definitely you get up from the bed suddenly. You must have seen that the it's common among adolescent teenagers and young girls, okay, and young women as well in early 20s. Suddenly, if they get up from the bed, or they were sitting and suddenly when they get up, they faint or they feel like a small head rush that takes place. It means they are suffering from anemia, either moderate to severe. Okay. So folic acid deficiency during pregnancy, it could lead to spina bifida. You can see here a small protrusion. This is actually the spinal cord, okay? Spinal cord, which is supposed to be within the vertebral column. Spinal cord, which is supposed to be within the vertebral column. Since the neural tube is the central nervous system which is under development when during the first 2 months of pregnancy. By third month or by the end of first trimester, the fetus's neural tube has to undergo complete closure. Only then the remaining part of the organs will develop, okay, within the uterus. So if the neural tube is not closed properly, the spinal cord which is going to form can escape from the vertebral column and it can protrude outside, okay. This is called spina bifida. So what happens is that usually in children who suffer from spina bifida, the lower extremities are not functional, okay, and it is in varying degree, depends upon the protrusion of the spina bifida, or depends upon the area which vertebral column is affected with spina bifida. Depending on that, the child's lower extremity, the child may be handicapped for the rest of its life, okay, be on wheelchair, or not able to walk properly, or not able to control their urination or defecation, okay. It is very subjective, depends on the type of spina bifida the child may be suffering from. Then anencephaly, it is the absence of the skull, okay, the absence of the skull, that is anencephaly. And cleft lip, cleft palate. So these are commonly associated with folic acid deficiency during pregnancy. So the best sources, definitely there are certain vegetarian sources as well. Best sources we will discuss first. So the causes of folic acid deficiency is first and foremost, your diet is not good. Your dietary intake of folic acid was not adequate. And usually it leads to megaloblastic anemia. Megaloblastic anemia. Can anyone who is from the medical background break down this term? Megaloblastic. Megaloblastic anemia. Spelling I have mentioned in the chat box. Megaloblastic means definitely large in size, but immature. Blastic means immature. Megacytic or something if you use, okay, that means it is just big sized cells, larger than usual, okay. But megaloblastic means definitely the size of the RBC is quite big as compared to the normal RBC, but are they mature enough? They're immature cells, okay. They have not attained maturity to function as an RBC. That is megaloblastic anemia. So folic acid deficiency is associated with megaloblastic anemia. And it is common among vegetarians who are from the lower socioeconomic backgrounds. Megaloblastic anemia is common among the vegetarians who are from the lower socioeconomic backgrounds due to poor intake of milk, fruits and vegetables and other non-vegetarian food as well. And certain cooking practices also, overboiling, overcooking, overfrying, deep frying, that can also destroy the existing folic acid. Then low absorption in case of certain gastric injuries or certain drugs, or if your diet does not have enough amount of iron and vitamin C, folic acid will not be adequately absorbed by the body. Okay. Iron, vitamin C, folic acid, they all work hand in hand. The presence of all these three elements will enhance each other's absorption. Okay. Folic acid, vitamin C, iron. The absence or deficiency in any one of these three can lead to a decreased absorption of the other two. Okay. And increased losses in case of hemodialysis. People who undergo hemodialysis, they also have a higher risk of folic acid deficiency because of the loss of folic acid through dialysis. Increased requirement, that is during growth for kids and during pregnancy, the requirement of folic acid is quite a bit higher requirement as compared to normal adults. And if that higher requirement is not maintained, automatically it will transform into deficiency. Okay. For during hemodialysis, people who undergo dialysis, folic acid is lost from the blood. And hookworm infestation, specifically common in children. Worm infestations are very common in children. It's not seen in adults at all. Okay, but worm infestation, hookworm infestation, tapeworm infestation, okay, all these helminthic infestations are common in children. Okay, so if they are undergoing certain worm infestation, definitely their body will undergo folic acid deficiency. Okay. Vitamin C, iron, and folic acid, they enhance each other's absorption. Vitamin C, folic acid, and iron. And also vitamin B12. Vitamin B12, you can get it only from non-vegetarian sources. And kids who are on anti-epileptic drugs, anti-convulsant drugs, okay? Kids who suffer from epilepsy or convulsions, they are put on anti-epileptic drugs, okay? These drugs can induce folic acid deficiency. Just like anti-epileptic drugs is notorious to induce the niacin deficiency as well, in the similar way, folic acid deficiency can also take place. So clinical features, it's very similar. We will see that. First, going through the best sources of folic acid source. Again, fenugreek leaves. Drumstick leaves is also there, but fenugreek leaves here is the best source of folic acid, which is recommended for pregnant women as well. Drumstick leaves along with fenugreek leaf, methi leaves. Okay, gogu leaves is also a good source of folic acid. These are vegetarian. These green leafy sources are for vegetarians. And fish like hilsa and pomfret. This is the hilsa fish which you see on the left side of the slide. It's a hilsa fish. And this is the pomfret fish, okay, on the right side, which you see. A really good source in the textbook. Those who have the textbook right now, just see the total amount of folate present in hilsa and pomfret per 100 gram and compare it to all the other vegetarian sources, including egg that is given. What is the per 100 gram folate present in hilsa and pomfret? Can you mention in the chat box? Yes, it is almost 2,875 for hilsa and 2,000, about 2,000. Anyways, it is about 2,000 microgram, per 100 gram in these two fishes, right? And what is the range? What is the range of the folates present in vegetarian sources? Just mention the range, per 100 gram range. Range means lower limit to upper limit. What is given in the textbook? Yes, the range is between 70 to 233 for all the vegetarian sources, microgram per 100 gram. And you can compare where this number lies, okay? So this is how non-vegetarian foods have in certain nutrient values, how non-vegetarian foods would have a certain degree of upper hand, okay? Does not mean you have to convert, but this is just your awareness. This is just the awareness. Okay. Green leafy vegetables, we have discussed. For vegetarians, you have the options of green leafy vegetables, Bengal gram, soybean, quinoa, sesame seeds, black sesame seeds, okay, curry leaves, mint leaves, beetroot, tamarind, okay, tamarind leaves, ripe mango, banana, fenugreek leaves, amaranth leaves, eggs, okay, these are the other options present. So quinoa is kind of a cereal, okay. It's page number 376. So the clinical features of the deficiency of deficiency of folic acid. Again, it's glossitis, diarrhea, irritability, sore tongue, forgetfulness, memory issues, weakness, tiredness, dyspnea. Okay, all the deficiencies we have discussed so far, more or less, it's the same kind of deficiency you see in folic acid deficiency as well, along with the symptoms of anemia. Okay. Am I audible now? So next is B12, cyanocobalamin. B12, cyanocobalamin. So until 1926, pernicious anemia was considered as a fatal disease, and nobody knew its origin. Okay, origin was unknown, and it was later understood that if the patient, like feeding a patient at least 0.5 kg of raw liver per day, pernicious anemia could be cured. That was the difficult strategy used. Okay, but why raw liver? Why not any other vegetarian source? Okay, slowly when the experiments came into being, okay, and understand the difference between the raw liver, what is present in this raw liver, and is what is not present in the plant-based diet, they found about vitamin B12, that is cyanocobalamin. Okay. So that's how this came into it came into light about the presence of this specific vitamin B complex called vitamin B12, cyanocobalamin. Okay. But till then, until 1926, people who suffered from pernicious anemia, it was kind of a death sentence. There was no other cure for them. Okay. So what are the major functions of vitamin B12? It is necessary for the red blood cell formation, RBC formation, for your nervous system's healthy functioning, prevention of certain types of anemia, one being pernicious anemia, and other neurological disturbances, functions primarily as coenzyme in intermediary metabolism as well, which helps coenzyme being, it helps acts as a catalyst to complete the metabolism. Okay. Metabolism of carbohydrates, proteins, fats, any. Deficiency will definitely lead to pernicious anemia, nerve degeneration as well. So absorption, vitamin B12 is present in the diet that has to have good source of protein. That is the reason why it is associated with all the non-vegetarian sources of food. Okay. And it is, as soon as the vitamin B12 with protein enters your stomach, okay, the stomach enzymes will liberate, okay, will detach the bond of vitamin B12 from the protein, and then it is taken away for absorption. So it is vitamin B12 is absorbed in your small intestine, and the end part of your ileum. Small intestine has three different parts. One is your duodenum, jejunum, and ileum. Ileum is the place from where the small intestine transforms into large, it attaches itself into large intestine. So the end part of the ileum, where it is going to transform into large intestine, that area is where majority of the vitamin B12 is absorbed. So here you can see the megaloblastic anemia that takes place. This is a normal blood cell, and this is the megaloblastic anemia, definitely larger in size, and it is immature. Okay, this blood cells, it is immature. So again, this is result, megaloblastic anemia results not just because of vitamin B12 deficiency, but also because of folic acid deficiency. We have discussed it recently. Okay, a lot of vitamin B complex deficiencies has to come together. It should be prevalent for a pretty long period of time. Only then megaloblastic anemia takes place, because blood cell formation takes at least few months. Okay, 3 months or so is taken for blood cells to form. So it does not happen overnight. Okay, the megaloblastic anemia is not formed overnight. It takes months and months to be prevalent and form into a symptoms that can be witnessed from outside. And there is a decreased DNA synthesis as well when it comes to megaloblastic anemia. Decrease of maturation of the RPCs. That's the reason why it is termed as megaloblastic anemia. Next you have is the pernicious anemia. In pernicious anemia, supplements we cannot recommend as such. Like the brand name of the supplements and all, that cannot be recommended. The only thing we can share as a basic information is just find, if you are in India, just find out for the brands which are FSSAI marked. Okay, brands which are FSSAI certified, products which are FSSAI certified, you can go forward with that. Okay, that certification has a value that it is suitable and it is completely healthy for human consumption. Okay, based on the regulatory policies that India has. Based on the regulatory policies that India has. So the products that you buy, which has FSSAI certification, FSSAI certification, if you compare the standards with an international level product, you may find something is missing. Okay, but India has certain regulations, certain policies, regulatory bodies have certain guidelines and principles. If that has been followed, okay, any industry, any manufacturer can get their product FSSAI certified. So based on the Indian standards, okay, you can directly go with FSSAI certified products for supplementation. Okay, for international standards, if you want a product which has an international standard, you definitely have to go for FAO certified, Food and Agricultural Organization certified, FAO certified, ISO certified. Okay, ISO certified or FAO certified products, you can go with that. So that you can trust completely. Okay, FSSAI is also a good system of management. Okay, there is no issues with that, but certain regulatory policies may vary when it comes to international standards. Okay, it doesn't mean it's a substandard product. Okay, it does not mean it's a substandard product, but you have to understand Indian laws are slightly different as compared to international laws. So coming to pernicious anemia. So when the parietal cells are the ones which are supposed to secrete hydrochloric acid, okay, in your stomach. When these are destroyed, the parietal cells produce the acid, hydrochloric acid. So in the presence of that acidic environment, we have seen that for iron absorption, acidic environment is important. Okay, acidic environment that your stomach gives in the presence of hydrochloric acid. Along with that, the acidic environment that citrus fruits and vegetables create, okay, it enhances the absorption of iron. Okay, so when the parietal cells are destroyed because of stomach ulcers, peptic ulcers, any trauma, any injury, inflammation, acidity, okay, any surgery that has took place because of which certain areas of the parietal cells are destroyed, hydrochloric acid is not produced in enough amount, iron absorption will be reduced. There will be decreased in iron absorption because there is no acidic environment for the iron to thrive and be absorbed. And parietal cells also secrete intrinsic factor. Intrinsic factors are like blood clotting factors. There are different intrinsic factors. Okay, so intrinsic factors are responsible for enhancing vitamin B12 absorption. So when parietal cells are destroyed in the stomach, neither they secrete hydrochloric acid, neither there is a secretion of intrinsic factors, because of which iron absorption along with that vitamin B12 absorption is also reduced. Okay, so that's how it leads to pernicious anemia. So what are the causes of this destruction of parietal cells? It could be inadequate ingestion, not having enough amount of iron or vitamin B12 in your diet. Okay, inadequate absorption and utilization of these vitamins in, even if you are having it in adequate amount, the absorption is inadequate. Okay, and even if the absorption is inadequate, the way how the body utilizes these the iron and vitamin B12, that is inadequate. Okay, increased requirement, that is during pregnancy. You are during pregnancy, you are having the same amount of iron that a non-pregnant woman has to have. Okay, that will also lead to deficiencies. So people who have pernicious anemia, they will have this lemon yellow kind of skin, very similar to jaundice. Okay, weakness, bleeding gums, loss of appetite, glossitis. Okay, and you can see here the skin comparison, which is done side by side. A yellow tint is there into the skin because of the presence of jaundice as well. Glossitis, you must have seen this particular symptom is appearing in every type of vitamin B complex deficiency. Frequent diarrhea, weight loss, and because of frequent diarrhea, appetite also goes down. General weakness, because appetite is not there, food is not there, nutrients are not there, energy will be not there. So general weakness and fatigue will be prevalent. Numbness of the limbs, that is not shown on the slide, but it is mentioned in the textbook. Your extremities, they become numb. Again, paresthesia. You see the repetition of the same symptoms happening over and over again. Coldness, difficulty in walking, that is the gait problem, balance problem. RDA of vitamin B12, no more than 2.5 milligrams per day is required. And these are the food that is rich in vitamin B12. So vegetarians and vegans, they can definitely go with curd, yogurt, milk. Okay, have dairy products, it is completely fine. Vegetarians can have at least one egg once a day. Okay, and vegans, they have to take vitamin B12 supplements along with calcium supplements. Okay, calcium, omega-3, vitamin B12 supplements has to be taken by vegans. For non-vegetarians, other sources, any sources of meat is a really good source of vitamin B12. Chicken breast, thighs, salmon fish, tuna fish, red meat, organ meats, fish, any forms of fish, prawns, seafood. And for vegans and vegetarians, if you're looking for some milk substitutes or plant-based milk substitutes, please go with don't make the plant-based milk at home. Okay, try to buy it and go for vitamin B12, vitamin D, and other nutrients, calcium as well, as specifically calcium, vitamin D, and vitamin B12, fortified plant-based milk or plant-based products, whatever a vegan diet requires. If that is something that you're going to buy from the market, please look for the fortified ones. Okay. And in general, vitamin B12 and vitamin D fortification is followed in all the sources of packaged milk based on your state, whichever state you are. If you check the package, okay, milk package, you will notice that it is either fortified with vitamin D, vitamin B12, or both. Okay. So that's a part of our Indian government regulation and as well as state regulation. You have to follow that. It will be stored in the liver, okay, for at least for 6 months. There will be no toxicity. Okay, this vitamin B complex toxicity rarely happens. Okay, it will be stored in the body, and toxicity never happens overnight. It has to months and months of overconsumption is something that leads to toxicity. And any excess amount of vitamin B12 is, if it is present in the body, your kidneys are continuously filtering it out and trying to maintain that homeostasis in the body. Okay. Fermented foods like curd is also a really good source of vitamin B12. Any fermented food for that matter, like kimchi and all. Is it clear about vitamin B12 so far? Yeah, cow milk also has vitamin B12, but if you compare it to the fortified milk, packaged milk, it is much less. Cow's milk has naturally, any form of animal milk, cattle milk will have vitamin B12. But when you compare it to the fortified packaged milk has much higher quality of it, higher quantity of it. Okay. Because when it comes to packaged milk, you have 3 different categories: full tone, medium tone, and skimmed milk. Okay. But the vitamin quantity has to be maintained the same throughout these different categories of milk. Okay, so for that, going with the fortified milk is the best option. If you check the page number 384, you can see the amount of vitamin B12 that is present in cow's milk and buffalo milk per 100 gram. Per 100 gram, vitamin B12 present in cow's milk and buffalo milk is mentioned in the on that table 19.4, which is much less. It is present. It's not like it is absent. It is present, but it is much less. Okay, so it is better to go for the fortified ones. So far, is it clear? Next is vitamin B6, pyridoxine, involved in protein metabolism. It's not involved in carbohydrates or fats, involved in protein metabolism, involved in the formation of hemoglobin, hormones, structural proteins, healthy development of the nervous system. Again, the same repetition you will see here, functions. Okay. And deficiency, it leads to tiredness, fatigue, irritability. You can see here that symptoms are repeating. Okay, all the vitamin B complexes are almost showcasing the very similar form of traits of symptoms. Premenstrual tension, PMS. Okay, infants may suffer from convulsions if there is a deficiency. Infants who are being breastfed are on breastfeeding. If mother is deficient in vitamin B6, infant will also be deficient in that. Okay. So it is a coenzyme in protein metabolism that we have seen. It is required to convert proteins into amino acid. Deamination and transamination, that is the biochemistry of it. We will not go in detail into that because that for diploma level it is not required. Okay. The symptoms of vitamin B6 deficiency, again, sore, glossy tongue, glossitis will be there, inflammation of the tongue, cracked and sore lips, angular stomatitis, ileosis, skin rashes, pimples, okay, skin rashes or itchy skin, dermatitis, it could lead to dermatitis as well. And certain central nervous system disturbances can also be seen in the levels of serotonin, okay, levels. It could lead to depression, okay, dermatitis of the scalp in kids, hyper irritability, okay, pyridoxine deficient kids are hyper irritable. They cry a lot and all in the infant stage. And the children who are fed with commercial milk formula, who are not fed on breast milk, okay, they also undergo pyridoxine deficiency, and you will see the same kind of depression, irritability, these kinds of symptoms in the children who are fed on formula diet, not on breast milk. Even the lactating mothers may showcase glossitis, ileosis kind of symptoms. Sideroblastic anemia is the kind of anemia associated with pyridoxine deficiency. Sideroblastic anemia, if you try to break this term, sidero, it relates to iron, blastic, immature, okay, anemia, decreased amount of healthy RBCs present, being formed in the body. So you can see here the RBC here is immature, but they are carrying a lot of ions, okay, iron molecules which they are carrying is too much, and it is overcompensating the iron deficiency. Okay, so that is the meaning of sideroblastic anemia. Immature RBCs holding on to a lot of iron molecules. Okay, it is because when pyridoxine deficiency takes place, body goes into a stage of hyperferemia. Hyperferemia means too much of iron molecules in the circulating blood. Too much of iron molecules in the circulating blood. So these many iron molecules have to go somewhere, has to attach to something, right? They they get attached to the RBCs. So that is why, and that is how you get sideroblastic anemia. Okay, these are dysfunction. These RBCs are dysfunctional. The main role of the RBC is to carry oxygen, but if they are latching onto too much of iron, they are immature and they are not latching onto too much of iron molecules, they will not carry adequate amount of oxygen. Okay, they're incapable of carrying adequate amount of oxygen. Okay, so they are dysfunctional. That's how it leads to anemia. Hyperferemia. I have mentioned in the chat box. Please check that. So too much of ferrous ions in the blood, circulating blood, gets attached to the immature RBC. That's how you get sideroblastic anemia. Sidero means too much of iron molecules. You can see here it is on the sides of the immature RBC. Too much of ferrous molecules have been attached, and this entire RBC is not mature. It is immature. That is why it is blastic. Anemia means decreased amounts of healthy RBCs in circulation. Okay, is it clear now? So treatment of sideroblastic anemia or treatment of the deficiency of pyridoxine deficiency anemia, you have to give 10 to 20 mg of vitamin is given orally, or either to if the person is admitted through parenteral route through IV fluids. Okay, this dose can be maintained. And if this deficiency happens during pregnancy because of excessive vomiting, because of morning sickness, and the woman is undergoing too much of vomiting, in that case, she may be put on IV fluids. Okay. She may be put on IV fluids, and with even in that, 20 mg of pyridoxine is given on IV fluids, or either through orally. You will have to avoid it, because what if she vomits again? The entire medicine will also go out. Okay, so it's better to put the mother, or the pregnant mother, who has hyperaminosis, hyperemesis gravidum. Okay, too much of morning sickness, too much of vomiting during the pregnancy is called hyperemesis gravidum. Okay, those mothers are admitted. They are put on IV fluids to maintain the fluid and to prevent the dehydration. Okay. So sources again: Hilsa fish, pomfret, Bombay duck, and the kingfish, vanjaram, or what is called chura and tuna, and all in other languages. Okay, this is the Hilsa fish, pomfret fish. This is the Bombay duck. Okay, vanjaram, mackerels, or sardines. Okay. Drumstick leaves are a good source of, for vegetarians now, drumstick leaves, walnut, pista, sunflower seeds, sunflower oil as well. Sesame seeds, white, is a good source of pyridoxine, vitamin B complex. Next is your pantothenic acid, vitamin B5. Function: it helps to produce antibodies. It helps in the production of cortisol, production of energy from carbohydrates, fats, and protein, metabolism of carbohydrates, fat, and protein, in short, and formation of acetylcholine and epinephrine. What is epinephrine? Anyone? Epinephrine. You must have heard about it somewhere else as well. It's a fight and flight hormone. The other name of it, adrenaline. Epinephrine is not an amino acid, it's a hormone secreted by your adrenal glands. Okay, it's called the fight and flight hormone. Okay, another name of epinephrine is adrenaline. Acetylcholine is etc. is a neurotransmitter, useful for your central nervous system. Okay, so these are the snapshot of the functions of vitamin B5, pantothenic acid. So in terms of the deficiency of pantothenic acid, paresthesia, again the same sensation of tingling, prickling, numbness in the person's skin, which starts from the tip of your lower extremities, upper extremities, and then it progresses towards, okay, and joint muscle aches or joint pains, okay, fading of hair color, anemia, reduced immunity, impaired antibody response, getting infections, you catch up with infections sooner, headache, depression, insomnia, fatigue. Okay, these all are the signs and symptoms associated with deficiency of pantothenic acid. Okay, more or less very common symptoms. RDA is 5 mg per day, and best sources of pantothenic acid is yeast, sunflower seeds, shiitake mushrooms, rice bran, egg yolk, and rice, which is red, brown rice. Both all forms of rices are good source of pantothenic acid. And black gram, rajma, goku leaves, baby corn, okay, coriander leaves, sheep liver. So these all are the other sources which are good sources of pantothenic acid as well. If you check on page number 395, they have mentioned in the table per 100 gram how much mg of pantothenic acid you will get is mentioned. Next is your biotin. Biotin plays a vital role in helping the body to metabolize proteins, fats, and carbohydrates. Helps the body to process glucose. Again, it is involved in the metabolism, just like majority of the vitamin B complexes, it is involved in the metabolism of macronutrients. It contributes towards healthy skin, nails, and hair. Therefore, it is found in majority of your cosmetic and health products of skin and hair. Nowadays, the gummies and all, it is sold like biotin supplements in the form of hair gummies, skin gummies, etc. The issue is that biotin is not the only nutrient which is associated with hair loss or something like that. There are other external factors along with biotin deficiency. Okay, there could be 5 different factors which is leading to your hair loss. Biotin deficiency could be one of them. So if you are taking only biotin supplements, you are just correcting one issue of the 5 other issues. Okay, so it's not always true that if you have biotin supplements, your skin health and hair health will improve. It's not always true, because hair loss is very subjective. It is genetic, it could be deficiency, it could be stress, it could be n other factors. Okay, it's not always the vitamin deficiency. There could be other factors associated with hair loss. But if you're giving the wrong treatment to the wrong problem, okay, it will not function. Okay, that is the reason why majority of the people who are taking hair gummies and skincare gummies, which is filled with biotin, but if it is not showing you the correct result, it means you are not addressing the root cause. Okay, definitely biotin is associated all the like if you do a research on 100 people who suffer from hair loss, you may find majority of them are deficient in biotin, but you will also find other data as well of other deficiencies. Okay, other lifestyle factors. Okay? These factors, these data you should not ignore. Okay, so here a biotin deficiency in those who have the textbook, the same image has been shown. Just an infant, the infant whom you see here, the child has a very severe case of dermatitis happening on the face. Okay, but in the textbook you will see the recovered version of the child as well. 15 days of biotin treatment has transformed the child's dermatitis into a completely healthy face. Okay, so that's the effect of biotin in skin health. Okay, and deficiency could lead to brittle nails, conjunctivitis, depression, dermatitis, fatigue. Okay, and hair loss as well, hallucination, loss of appetite, muscle pain, nausea, neurological symptoms like paresthesia, numbness, tingling, weakness, generalized weakness, fatigue. Okay, these things are associated with biotin deficiency. So RDA for biotin is around 25 microgram per deciliter for adults, and for infants it is 15 to 25 microgram per deciliters. So the biotin-rich food: egg, paneer, khoya, walnut, pista, and button mushroom, yellow capsicum. These all are good sources of biotin. Based on your diet preferences, you can choose. Biotin tablets are also, supplements are also readily available. You take any vitamin supplements, they do have a focus on biotin. Collagen supplements, vitamin supplements, whatever supplements you take, they have a specific consideration given to biotin as well. Specifically when it is something that relates to enhancing your look, your hair health, skin health. Okay, any supplements that you take like that, it has a specific additional importance given to biotin content as well. Okay, so it is very easy to get biotin content through your vitamin supplements, multivitamins. So as a part of your assignment, all the vitamin B complexes we have discussed so far, you have to make a table. You have to chart the data in a tabular form. All the names of the vitamin B complexes, both the names. Okay, like vitamin B1 is called thiamine. Okay, vitamin B2 is called riboflavin. Like that, both the names. Their major deficiencies. Okay, how do you diagnose them? Diagnosis is not important, because majority of the cases diagnosis is going to be same. It is going to be blood test. So remove the diagnosis part. Treatment part, you can add that. Okay, best sources: vegetarian and non-vegetarian sources. At least 5 to 6 best sources you have to add. So you can add all these columns: the both the names of the vitamin B complexes, what are the deficiencies of this, how do you treat them, and what is the best source. The functions you have to read from the textbook, that is your self-study. You have to invest your time into reading functions. Okay, you have to go through it. In case of any doubt, if you want further clarification regarding the functions and all, you can contact me directly on my WhatsApp number.